Hi, my name is Dr. Donald Ang. I'm one of the cardiologists in Island Hospital, and my special focus is on interventional cardiology. But there is no one particular factor. But if you ask me, I think risk factors like high blood pressure, diabetes, and also obesity play an important role in the development of cardiovascular disease among adults these days. Okay, on this World Heart Day, to the young adults, my advice is your mental and your physical well-being all work together. So it's important that you dedicate and devote enough time for things like good sleeping pattern and good sleeping habits, good diet, which means taking more vegetables and fruits and less red meat, for example, and also exercise regularly. I'm not asking you to exercise too much, but I would say aerobic exercises, 30 minutes per session for 3 to 4 times a week, and that would be sufficient. Okay, so that's a good question. There are two components to this question. The first one is that what are the suitable exercises? I think there are 3 good exercises generally. Number 1, jogging. Number 2, swimming. And number 3, cycling. These are all exercises that increases our aerobic activities. So I think these are the 3 main forms of exercises that I would advocate as a cardiologist. With regards to achieving a particular target heart rate, my advice is not to be too over concerned about a particular number or figure, but the general guidelines are that you can use 220 minus your age as the maximum heart rate. Okay, so for example, you are 40 years old, 220 minus 40 means you can achieve a maximum heart rate of 180 beats per minute. But if you were to exercise aerobically, anything above 80% of your maximum predicted heart rate is actually a good workout and is sufficient to gain all the benefits from an aerobic exercise. Well, as a cardiologist, I also have a busy lifestyle in that work is always is very demanding. My focus is usually on ensuring that my diet is sensible, which means that as much as possible, reasonable amount of fruits and vegetables, and as far as possible try to avoid too much red meat. At the same time, I would try to ensure that I do 2 to 3 sessions of exercises, for example like tennis, in 1 week, something which I enjoy. Okay, I think for everyone, the important thing is to watch your weight. I think obesity is going to be a rampant problem, especially in both developing and developed nations. So I think watch your weight, ensure that you do not cross the limits of BMI of greater than 30, for example. Okay, so weight is very, very important. And of course, for those who smoke, quitting smoking is probably the best thing you can do in your life. In conjunction with World Heart Day, I would advise everyone out there to eat sensibly, watch your weight, and have good sleeping patterns and habits. Thank you.